Ranolazine ER is used to treat a specific type of chest pain called chronic angina. It helps to reduce the frequency of chest pain and may improve your ability to exercise. Unlike other angina medications, Ranolazine ER works differently and can be used in combination with other angina drugs such as nitrates, calcium channel blockers, and beta blockers. It is believed to work by improving the heart's ability to use oxygen, allowing it to do more work with less oxygen. Before you start taking Ranolazine, make sure to read the patient information leaflet from your pharmacist. Take this medication as directed by your doctor, usually twice daily, with or without food. Swallow the medication whole, and do not crush, chew, or split tablets. Also, avoid eating grapefruit or drinking grapefruit juice while using this medication unless your doctor or pharmacist says it's safe. The dosage is based on your medical condition, response to treatment, and other medications you may be taking. Use this medication regularly to get the most benefit from it, and take it at the same times each day to help you remember. This medication should not be used to treat angina when it occurs. Use other medications as directed by your doctor. And remember to tell your doctor if your condition does not get better or if it gets worse. Some common side effects of Ranolazine ER include dizziness, headache, lightheadedness, nausea, tiredness, and constipation. If these effects persist or worsen, notify your doctor or pharmacist. To reduce the risk of dizziness and lightheadedness, make sure to get up slowly when rising from a sitting or lying position. Remember that your doctor has prescribed this medication because they believe the benefits outweigh the potential risks. Many people using this medication do not experience serious side effects. Be sure to tell your doctor right away if you experience any serious side effects, such as signs of kidney problems or very serious side effects like fainting, severe dizziness, or fast/irregular heartbeat. A serious allergic reaction to this drug is rare, but seek medical help immediately if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects not listed. If you're in the US, you can call your doctor for medical advice about side effects, or report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects, or report side effects to Health Canada at 1-866-234-2345. Before taking Ranolazine, make sure to check with your doctor or pharmacist if you have any allergies or if you are taking any other medications. Ranolazine may contain ingredients that can cause allergic reactions, so it's important to talk to your pharmacist for more information. Let your doctor or pharmacist know about your medical history, especially if you have any liver or kidney problems before using this medication. Ranolazine can affect the rhythm of your heart, which may cause serious symptoms that need immediate medical attention. The risk of this condition may increase if you have certain medical conditions or are taking other medications that can also affect your heart rhythm. Low levels of potassium or magnesium in your blood can also increase the risk of heart rhythm problems. It's important to talk to your doctor about using Ranolazine safely, especially if you are using certain drugs or have conditions like severe sweating, diarrhea, or vomiting. This medication may cause dizziness, and using alcohol or marijuana can make it worse. Avoid driving or using machinery until you can do it safely, and limit alcoholic beverages. Make sure to talk to your doctor if you are using marijuana. Before having surgery, inform your doctor about all the medications and products you are using. Older adults may be more sensitive to the side effects of this drug, especially the effects on heart rhythm. During pregnancy, use this medication only if clearly needed and discuss the risks and benefits with your doctor. It's unknown if this medication passes into breast milk, so consult your doctor before breastfeeding. It's important to be aware of how Ranolazine ER may interact with other medications. This can affect how well the medication works and may increase your risk of serious side effects. Make sure to keep a list of all the medications and herbal products you use and share it with your doctor and pharmacist. It's important to not start, stop, or change the dosage of any medicines without your doctor's approval. Certain medications can affect how your body removes Ranolazine, which can impact its effectiveness. Examples include certain antifungals, antibiotics, HIV medications, and drugs used to treat seizures. Be sure to discuss any potential interactions with your doctor before starting Ranolazine ER. If someone takes too much Ranolazine ER and has serious symptoms like fainting or trouble breathing, they should call 911. Otherwise, they should call a poison control center right away. U.S. residents can call their local poison control center at 1-800-222-1222. Canada residents can call a provincial poison control center. Symptoms of overdose may include severe dizziness or fainting, fast or irregular heartbeat, mental or mood changes like confusion or hallucinations, vomiting, severe tremor, or unsteadiness. It's important not to share this medication with anyone else. Your doctor may want to do some lab tests, like checking your kidney function, while you're taking this medication. Make sure to keep all your medical and lab appointments and talk to your doctor if you have any questions. If you forget to take a dose, just wait until your next scheduled dose. Don't take extra to make up for it. Keep Ranolazine ER at room temperature and away from light and moisture. Avoid storing it in the bathroom and make sure to keep it out of reach of children and pets. When it's time to dispose of Ranolazine ER, do not flush it down the toilet or pour it into a drain unless instructed. Instead, properly discard it when it's expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.